Seventh nerve is always one of the hardest. Look up to the ceiling, like you're looking up. Because if you have a patient, if you tell a patient, wrinkle your forehead, they're going to be like, they often can't do it. So you want to come up with, ways to get them to do things. It's also true for the motor examination. Mimic or mime what you want them to do, okay? And then they'll be able to do it very quickly, and you'll be able to, escalate through your examination skills very quickly. Yes, Ryan.
A couple things. You don't have to do light touch or pain on the plantar part of the foot. You can just do it on the dorsal part of the foot.
The distalmost aspect is usually plantar. But the problem, though, with light touch versus pinprick is that people often have calluses on their lower extremities on the plantar aspect. And so you might inappropriately get an abnormal response just because they're a runner, for example. So what you're going to be graded upon is, did you go to the distalmost aspect of the foot? If you checked it dorsally and Megan checks it on the plantar aspect, that's not how you're going to lose points. You're going to lose points because you did the right arm and then the right leg, and then the left arm and then the left leg. You need to do right, left, right, left, right, left for everything, okay? Yes?
Two other questions. So do we do arms for sensory? And then the second question is, for the tuning fork, and sorry to be nitpicky, but I think we've all been burned a little bit in the past. So before, at one point you showed us we just kind of snap the tuning fork, but then you're hitting it on your palm. Does that matter?
The one thing I don't want you to do is do that, right? What you usually do is you pinch it and you go like this, or you can just gently tap your palm. I think that either's fine, but usually most people would pinch it and pull their fingers off of it like that. The second question that you asked was...
Sensory, do we just do lower extremities, or
yes.
do we do it for the arms as well?
Your vignettes will be very, 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 very specific, and they'll be very short. You open up the, envelope on the door, and it may say, go into the room and do exactly this and this and this. You can walk into the room. You do not need to spend time walking up to the patient saying, hi, my name is Ryan, and I'm going to be doing a sensory examination on you. So, you don't need to go through that whole aspect of it. Rather, what you can do is open up the chart, read what it is, make sure that as you're reading it, you remember it, put the chart back in, you walk in the room and say, hey, I'm going to quickly do a sensory exam on you, okay? It's okay if I start? Sure. And then you start and just get right into it. Don't waste your time on little things. But the examination, though, will be very specific. And if it wants you to do both upper and lower, you do both upper and lower. If it says only do lower, you only do lower. For sensory examination, I'm asking you guys to do screening testing. And screening testing means looking at the longest nerve in the body. And that means, therefore, focusing on the legs for sensory. For motor, you've got to do upstairs and downstairs. For reflexes, you've got to go upstairs and downstairs. For sensory, you do lower extremities. Unless you've got abnormalities, you never stop at an abnormal level. Then you go upstairs to the arms if they've been abnormal the entire leg. Yes, Megan?
On the vibration, you said you just go on that toe till it extinguishes, then you take it again and go on the other toe. You don't have to go down the joints on the other leg.
No, you don't have to. You wouldn't be wrong to do it, but vibration is usually something like this. Can you feel this is vibrating? Okay. Good. Maybe close your eyes. Tell me, is it vibrating now?
Yes.
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 Good. It's going to slow down and peter out. Tell me when it's absolutely gone.
Gone.
Good. I'm going to do the same thing over here. Can you feel it vibrating now?
Yes.
Now.
Yes.
Now?
Yes.
Now?
Yes.
Tell me when it's 100% gone. Good. Is there a difference between the vibration on the right versus the left?
No.
Good. Yes, Tony.
Will the patient be answering truthfully, or are they acting a certain deficit?
My patients for the 3 neurology doors will not lie to you. They will be telling you exactly what they think is true. So nothing to worry about there. Yes?
We do have to grade. That's in the room, right? So we just stay there? And
Yes. If you are asked to write anything down, you will do it in the room. So once you're, like, let's say I asked you to do 10 reflexes. And by the way, the door will tell you everything you need to do. So it would never tell you to just do reflexes, and suddenly, bam, the standardized patient gives you a form to fill out. No, the door would tell you exactly what to do. Go in, do this, and then do this. And so once you're finished doing the reflexes, if I was going to ask you to rate them, then the patient would give you a piece of paper and say, would you please write down your results? Don't forget to log into the computer for every room. Don't forget to put your name on each piece of paper if you have to do that, okay? Yes,
We leave the paper at the door.
and you give it right back to the patient.
I
And
mean,
paper-
the scenario,
Yes.
when you walk in, you don't take it in.
I guess you could take it in, but I don't think that you would need to. Any other questions? Because this should be one of the easiest ways to get 10% of your grade for this course. It really should. You can understand though that if when we never did this type of testing before, people could graduate from the brain and behavior course and really never know how to do a simple examination. And so my goal is just to make sure that, not that you know how to finesse all the subtleties of documenting stuff, but rather, do you know the big picture? Do you know how to do motor, sensory, reflexes, cranial nerves? Do you know how to grade motor and reflexes on the appropriate 5 and 4-point scale? In the future, in your third year, that's when you're going to truly learn the difference between a 2 versus a 1 versus a 3. Yes?
How many rooms are there?
There will be 6 rooms. The last room will be a communal room like this one, where it will consist as its own station. So there'll be 5 doors technically, and then one last door. The last door is where you all walk into one room and you do something. It's not that hard to figure out what that one's going to be, I suspect. It could be so inappropriate right now. Any other questions? You guys feel ready for it?
Yeah.
Awesome, you guys did very well.